Hi everyone, my name is Kate Jesus. I'm the South Western Sydney District Manager for Consumer and Community Participation. I'll be the MC for today's showcase. I'm so excited to be able to talk to you all about South Western Sydney Consumer Research Committee and the experiences and the goals for the future. If you have any questions throughout the session, please add them into the chat box and we'll get to them a little bit later in the group. So first of all, I'd like to pass over to Karen Beatson, who will do the Acknowledgement of Country.
And apologies, I couldn't get myself off mute. Welcome everyone. My name is Karen Beatson. I'm a Mandan woman from South West Queensland, but I was actually born on Cadigal land in Redfern and grew up out here on Dharawal land for the last 40 odd years. I currently work with the local health district as the Deputy Director of Aboriginal Health, and I'm very honoured to be asked to acknowledge country today. An acknowledgement of country is not a traditional practice. It is a practice that has emerged since colonisation and only in recent years to acknowledge that the lands that we are all living and working on are Aboriginal lands. The local health district operates on the lands of the Gundungurra, Darug and Dharawal lands. I'm coming to you today from the lands of the Dharawal. And I just wanted to say something about Aboriginal people and their participation in research. Since Aboriginal people believe we have been here since time began, but in modern science, I think there, some disputes up to 60, 40, 100,000 years since Aboriginal people have been occupying the lands called Australia. Aboriginal people have been researchers as part of their lives and the way that we conducted business. We would, collate, gather data. We would be, observe. We would discuss that. We would share, and we would change and look at how the environment around us. And we would gather that information and we would use that to continue our survival. And it was very important that we would, look at the sky, the waterways and our land and observe and capture that and discuss that. We had an oral history. Sometimes that was recorded via our art, on walls, rocks, paintings, drawings. Some lasted long times and some would disappear. But those oral stories have been passed down. It's only been since the impact of colonisation that Aboriginal people's knowledge has been dismissed or discredited in some ways. And it's really nice to see in 2023 that Aboriginal peoples are being incorporated and included and talked about in a different way. During those early years, there was a lot of research on Aboriginal people, and that was often done without our permission. We didn't know at times it was being captured, and we're one of the most recorded peoples in Australia. And so our impact has been not a positive one in the beginning. So to actually include Aboriginal people in research and have consumer participation, we have to create avenues of cultural safety. We have to make the research culturally responsive, and we have to do it in a way that is ethical to our people. So I love that we are included now in research. The AH and MRC's Aboriginal ethical principles are a way that our district has embraced Aboriginal people into research. And we now have a partnership and a directorate where we can share that knowledge and participate openly. So I'm really glad that I today can acknowledge that this is Aboriginal land, and I welcome all the Aboriginal people joining today. And I would like to pay respects to my elders, my ancestors, who have continued to share and pass down their knowledge so we can have those benefits today. And I would like to all welcome you and hope that this seminar is guided by those principles around those ethical guidelines. And I can't wait to hear and see what we have in this consumer feedback. So it always was and always will be Aboriginal land. Welcome, everyone.
Thank you, Karen. I would now like to introduce the Chief Executive of South Western Sydney Local Health District, Amanda Larkin, to give the opening address.
Thanks, Kate. And thank you, everyone, for inviting me today. These sessions on research for South Western, I think, have been a wonderful way to be able to broadcast research across the district, and especially during the challenging times of COVID over the last couple of years. Can I just also take the opportunity to thank Karen? Karen not only gave us an acknowledgement and a welcome acknowledgement, to country, but what she did was really give us a deeper understanding of Aboriginal culture, of how these elements that we talk about in health were and have been part of Aboriginal culture for thousands of years, and how we as a district, but more importantly as a community and as a nation, need to embrace that culture. And as we know, there is much talk about that happening in relation to how we as a country move forward at the moment. So Karen, thank you always for the words that you shared with us. And can I also acknowledge the traditional owners of the lands on which we are meeting and pay my respects to elders past, present and emerging. And Karen's last line, I think, is the most important, that says this was, is and always will be Aboriginal land, and we as Australians need to think carefully about what those words mean. So thank you, Karen, for that. As I said, this is the one of the last instalments of our Showcase Online series. We are planning our showcase in person on sites and together in September, which I think will be fantastic for us all to be together again. But as I said, the online series has been a great way to share research across the district over these challenging times. And I think it's also that we've needed to embrace different ways of sharing the information and distributing it across the district. Today, I think is really exciting, could I say to you. We're focusing on consumer research and the Consumer Research Committee and the work that they do across the district and what we do in partnership with our consumers. They are very much embedded in the way that South Western operates, and their role in research, I think, and I trust we all accept, is absolutely essential. Can I acknowledge a number of people initially? Can I acknowledge Kate Jesus, our District Manager for Consumer and Community Participation. And Kate, the important role you play in advocating for consumer participation, but most importantly, supporting our consumers across the district. Dr. Bernadette Brady, who's well known to us all in her research and physiotherapy and clinical specialist role. Anjo Kelly, a rheumatologist, Liverpool Hospital and Director of Medical Education. Eileen McDonald, could I warmly welcome you, Eileen, as the Chair of Consumer Research, of our Consumer Research Committee and Deputy Chair of the Macarthur Consumer and Community Participation Network. You do a fantastic job, Eileen, in terms of advocating for, but also inspiring our consumer and consumer involvement in research, which is just fantastic. and a dear colleague and I hope friend, Carol Bleskins, member of the Consumer Research Committee, and a long time consumer who has participated in so many different ways in Southwestern. Carol, it's great to have you with us today. And also, can I just acknowledge our guest speakers, Shana Harm and David Napier. So it's great to have both of you here to talk about consumer participation in research. Could I just open briefly by saying that we as a district over the last decade have really grown and invested and supported research. And why is that so important? I suppose my very clear message to you all in the platform is that there is a triumvirate in relation to how we provide healthcare. And the triumvirate sits between education, clinical care, and when I say clinical care, I'm talking about care right across the continuum, from hospital, community, right through to population health and all the other elements that we do, but also with research. Those three elements together are essential in terms of ensuring that care is appropriate, contemporary, cutting edge, and that we're ensuring that our community receive the best care. We've committed extensively to research. We've written 2 research plans, and our research is very much, and our priorities around research are very much embedded in the strategic plan that we released at the end of last year, the 2022 to 27 framework that really demonstrates our commitment to research, what we want to achieve, but what we know is that good care and good service delivery is very much wrapped around research. And we also know that what we want to be able to do is to attract and retain staff in the district, and research is a critical element of that. As I said earlier on, we're looking to have our research showcase back together towards the end of the year. And I think that's a fantastic opportunity for us to hear directly from our researchers, but also to be together in a collegiate way and share the work that we're doing and participate together in that research agenda. If I can just say, the Consumer Research Committee was initiated in 2021. I can't emphasize enough to everyone online the absolute importance of consumer involvement in research in terms of the issues that we research, how we shape the methodology, how we look at the outcomes, and how we then deliver the outcomes we trust into practice, and ensuring that it is closely aligned with the needs and the concerns of our consumers is essential. So involving them in the research is such an integral part. And with the aim of the committee, though, has been seeing more consumers across Southwest be involved in all levels of research. And as I said, in the co-design and the evaluation, and obviously in the development. So this is a really important session that we hear today, where we hear about the work that the consumers have been involved with, and understanding, I think, deeply the role that they play. As a newly formed committee, I'm proud of how much this team's achieved. The capacity of the team has been built, and we've provided, training for the group. We've developed an information sharing platform to help facilitate conversation, exchange information. Research isn't easy. And so for all of us being able to share our thinking, our ideas and the new information, we've supported and upskilled researchers through their attendance and participation in various research workshops. And obviously we've been involved, the committee's been involved in review of grant applications, which is such an important part of the work that we do in terms of research overall. The committee is also leading a scoping study in collaboration with the district's research directorate to understand the current consumer involvement within research across the district. And I think we've grown that capability over a longer period of time. I want to thank the Consumer Research Committee. Not easy work. It can be quite challenging. Lots of information, lots of reading, lots of time to really understand what the researchers are trying to achieve, and then being in a position to provide good and informed advice and direction. So I really want to thank you in that regard. I hope you've all been inspired by the advances in the district to involve consumers in the community in the development of our research, and not only in our research, in all aspects of care delivery, of how we've shaped services over many years. And so this element of consumer involvement, I think, is really essential. So as I said, this is the final instalment of our series, but being the final one, by no means is it not one of the most important. Our work needs to be shaped by, developed through the eyes and the thoughts and ideas of our consumers, because the reality is, if we're not consumer focused, if we're not patient focused around what we do, then the real value of care delivery is lost if we've not got consumers in our sights. So thank you to everyone for the preparation for today, all the work that's been put in, for the role of the committee. And I hope this is just a taste of some of the work that we've done, and I'm sure it will evolve more strongly over the next years. So thank you, Kate.
Thank you, Amanda. I would now like to introduce Karen Bleskens, who was the former chair of the Southwestern Sydney Consumer Research Committee and the 2022 recipient of the Southwestern Sydney Harry Collins Award for Excellence in Consumer and Community Participation. She will be setting the scene for today's showcase.
Thank you, Kate, and thank you, Amanda, for your warm welcome, and also thank you to Karen for her acknowledgement to country. So, as the past chair of the Consumer Research Committee and someone who's been involved with South West Sydney's local health district since its inception of the Consumer Participation Program in 2001, I'm aware that there's been a long history within the district of embedding consumers into their health service. So I wanted to talk a little bit about a more recent innovation that the district has developed. Consumer and Community Participation Unit, in partnership with the Research Directorate, has identified the need to improve the processes in which clinical researchers engage with consumers. With endorsement from the district's peak consumer group, the Consumer and Community Council, the Research Committee was formalised in 2021. So we are a group of consumers from across the district who have a passion and an interest in ensuring that researchers and consumers work together for the better outcomes of people in the community and patients at the hospital. The committee's role was to support the district researchers to partner with consumers and community members in a meaningful way across all aspects of research. So as Amanda has mentioned briefly, to date, we've supported researchers through our attendance and participation at various research workshops and webinars and showcases such as this one. We've also provided input into the review of grant applications that have been put up by researchers. And more recently, the Consumer Research Committee are leading a scoping study in collaboration with the district's Research Directorate to understand the current consumer involvement within research across the district. The aim is to provide the Consumer Research Committee, the Research Directorate, and the Consumer and Community Participation Unit with an overview of where and how consumers are involved in all aspects of research across the district, which we know is just so important to ensure that consumers have a voice within research that's happening. The finding from the survey that we hope to initiate in the next week or two will be utilised to inform recommendations for how the district can continue to work meaningfully with consumers, clinicians and researchers, all in partnership in research across the district. Thank you.
Thank you, Carol. So now I'd like to introduce our first consumer, Shana Hahn, who will give her insight on her experiences in using the public health system.
Hi, my name is Shana Hahn. I am actually a registered nurse and was working in community when I fell pregnant with my first child who's almost 3 now. While I was pregnant, I suffered from hyperemesis gravidarum. And with hyperemesis gravidarum, you end up extremely sick and it lasts the entire pregnancy. My first admission to hospital was when I was 8 weeks pregnant, and I passed out in the middle of Liverpool Westfield Shopping Centre and was carted off in an ambulance to Fairfield. When I got the diagnosis of hyperemesis gravidarum, it was good and bad. It was bad because it completely sucks, but it was good because I then had a way to figure out what was happening and what might help. One of the things that helped me so much was to get IV fluids 3 times a week. There was no service available in the district at the time in order for me to be able to get that. So I was stuck going to emergency department, or my GP was actually willing to give me IV fluids via cannula several times a week. This is not cheap. They are not covered for this under Medicare, so I was paying for a gap each time, even though my doctor was bulk billing me. With my second pregnancy, I had hyperemesis again, and straight away got onto my doctor and started going in regularly for the appointments again and paying for them again. Whenever my doctor wasn't available, I was falling back onto emergency because it's the only way that I could get fluids and survive. When you're vomiting 20 to 30 times a day, and the only way you can stay hydrated is for IV fluids. And so after one of my admissions to ED, I got a phone call asking if I would be willing to complete a survey into hyperemesis and my experience within the local health district with it. And of course, I was willing to do that. And a short survey turned into a very long conversation because I had a lot to say. And from there, I was asked if I would like to contribute more into the research in that area. And I said yes. I have now seen that there's a new way in this area that women are able to be treated with hyperemesis. And that is that there is now research being done into nurses and midwives attending women at home and supplying IV fluids at home, so you don't have to figure out how to get out, how to do it, and like how to survive day to day. Someone is coming and is able to give IV fluids. And by watching that research, it gives me a lot of hope, and being able to contribute in what I experienced, and that now turning into something practical for many women is amazing. I always wanted a big family, so after having hyperemesis twice, I now feel confident that I could get pregnant again and actually get through that pregnancy and not have to consider terminating, which is a conversation that my partner and I have had during pregnancy because of how terrible it is, even though we wanted the kids. I started in that project a little bit later. They'd already had a lot of the planning done and knew what direction that they wanted to take it. And so coming in, I have been attending meetings via Zoom and able to give a lot of feedback into other circumstances that the woman might be facing. All the information is, of course, de-identified, but they will refer to specific patients and, hey, this patient is having these kinds of issues in that they can't take time off work because they are sick. And I've been able to suggest, like, talking to social workers, and I know that there are Centrelink payments. So is that something that could be included in the service, that they are referred on to extra help in those circumstances, as well as bringing up the point of a dietitian. When you are sick constantly, then you don't want to eat. You don't eat for months. I lost so much weight when I was pregnant, which is not what you want. It's the one time you're allowed to put weight on, and I didn't. So bringing up those kinds of points where a dietitian referral is something that a lot of women would benefit from. It's something that I experienced, so I can give feedback on it. I had to pay for a private dietitian that had no idea about hyperemesis because it's not something that happens in every pregnancy. So being able to give that feedback, that having someone on the staff that can understand what is happening would be very beneficial. Since then, I've also started helping out with another project, which is to do with contraception after birth to improve the spacing between births for women in the district. But it's recommended at least 12 months or after a C-section, 18 months before a woman will fall pregnant again. But it's difficult to find data as a consumer on what kind of contraception you should use after birth to prevent further pregnancy until you're ready. And with that project, we've come in a lot earlier in the project, and we've been able to offer feedback on pamphlets. We've been able to offer feedback on having when to have the conversation during antenatal rather than on the ward, so that if a woman chooses to use an IUD, they could be brought into it can be put in the baby bag to take to hospital and be placed on the ward, rather than waiting for 6 to 8 weeks for a follow-up appointment with a GP and then having to worry about a script. So having these conversations before the birth is something that we were able to bring up with the researchers that can have an impact on women in the future and them having a choice on birth spacing with their pregnancies. Some of the things that I felt have been difficult with being a consumer representative is as far as trying to find a quiet space at home with 2 kids. So Zoom meetings sometimes aren't always the most practical way of doing things. It suits a lot of people, but it doesn't suit everyone. I actually prefer when I can to come into the centre, because if I can strap the kids in the pram and take them to a new place, they actually sit quietly. Whereas if they're at home, they'll run around and scream as much as possible. But with that comes, I've always been offered parking tickets and the like, which has been amazing, so that I don't have to worry about parking and paying for parking. I can always park and get here when I need to. And just making sure that I plan around the meetings. So it's been really helpful to have the meetings come up on my calendar on my phone, on the Google Calendars and everything like that, so that they automatically schedule. That's been fantastic because I haven't missed one yet.
Thank you.
Yeah.
So I'm just going to pop in here from the side and ask you a few questions from the point of view of a researcher. So how would researchers best get people like you involved in research?
So with me, it worked because I was actively interested in answering survey questions. So surveys are a general part of hospital life, and honestly, most places have surveys for any service that's provided. So anyone that shows a particular interest in that survey and answering the questions would be a possible candidate for asking further and having more input, because they're already showing that they have a point of view and something to say.
And for all the consumers that are online thinking about being more involved in research, what has been the highlights for you, 2 projects that you've involved in?
Being able to see the change. Like, I go to mothers groups now, and if someone's really ill because they're pregnant, I can say, get in contact with the hospital, just go to emergency, and when they ask you questions, say yes. Like, do it. Like, there is a way out. And even on Facebook groups for hyperemesis and the like, if someone is in the area and they're like, I'm so sick, I haven't eaten for days and I'm not even peeing, I jump in and I say, go to the hospital, just do it, just do it. I promise that someone will help you. And being able to offer that support. And then in my own life, being able to know that the health service will cover me when I need it now. I won't have to pay for doctor's appointments. As this rolls out further in the district, I won't have to pay to go to my doctor 3 times a week to get IV fluids. I won't have to go and buy IV fluids and giving sets and take them to a GP and beg for fluids. I won't have to sit in an emergency for 8 to 10 hours because I'm not an emergency, but it's the only place I can go. So it's going to have a huge impact. And even with my family planning in future, it's having a big impact because it's taken some of the pressure off of I'm not going to be wiped out for 8 months and completely unable to help and look after my kids. Because if I can get the IV fluids, I feel great for a little while and I can function.
Yeah, I think that's an amazing example of how you've benefited yourself now and in the future, how you've helped other people in the community and even just the people that you come across day to day that you see are struggling with the same issue that you've had. So that's an amazing example. Thank you so much.
Yeah. Oh, yeah. Thank you.
Thank you, Shana. Your story has really shown the value of consumer participation in all areas of healthcare, and we also appreciate your consumer advocacy and leadership. I now want to introduce David Napier, who is a community member for the local health district. He's been around for a number of years and concentrating on his efforts on patient-centered care. David has pre-recorded his session, so now I'd like to play that for you.
Thanks for inviting me to speak. Not many of you know this is Rare Disease Day worldwide, hence the t-shirt I am wearing. I have a rare condition which is called stiff person syndrome, and it is progressive and incurable. That's why being involved in research is so important to me. It is through research that new means of treatment can hopefully be found. But therein lies the rub. Who's going to spend time researching a condition most people have never even heard of? Until Celine Dion was diagnosed with it, you could not get anyone to listen to you. This condition affects 1 in a million people. Lucky me. Right, I've got that off my chest. A number of years ago, I was approached by Carol to join MSK CAG. So after being vetted, I began my journey into research. I was a novice. There were times when I thought to myself, what am I doing here? This is all too hard. But believe it or not, I'm not a quitter. Must be my Scottish stubborn streak. You may have noticed I speak with a slight accent. Clinical trials permit testing and monitoring of the effects of an intervention on a large number of people to ensure that any improvement as a result of the intervention occurs for many people and is not just a random effect for one person. Most medical interventions are a direct result of clinical research. New interventions for most diseases and conditions, including cancer, heart disease, high blood pressure, and asthma, have been developed through clinical research. Clinical trials are often lead to new interventions becoming available that help people to live longer and have less pain or disability. The use of the sentinel node biopsy has significantly improved the treatment of breast cancer. Clinical trials can also help to improve healthcare services by raising standards of treatment. My involvement with MSK CAG has grown over the intervening years. I'm quite an expert with Zoom. Many research opportunities have come in our purview, but none as yet have come to fruition. You early know that research takes a lot of time. My most satisfying involvement would have to be as part of the team with Dr. Ayana Kelly and the other members of MSK CAG and physio and med students, looking at person-centered care in rheumatoid arthritis. I was in at the beginning in selecting the students for the grants that were given to successful applicants. Over the intervening period, the following has occurred: a co-led review in line with our philosophy that all projects will be co-led by a researcher and a consumer. Dr. Kelly and myself co-led the management of 4 people in Scummers Fellowship, funded by UNSW, to undertake a qualitative, systematic review, identifying what people with RA felt about their care. Dr. Aditi Shukla, advanced room trainee, plus 3 other members in room physio and 2 med students did this review with a poster abstract submitted and accepted by the ARA conference mid-year. A number of other conferences are also in sight for this paper to be presented at. It is pleasing to note that all 4 of the scholarship recipients have wanted to stay on the PC steering group, and we all will be involved in other aspects of the study. I have found working with the team a real privilege. Too often and for far too long, consumer involvement has just been a tick-the-box exercise with no real value being placed on the consumer input. Well, alongside Dr. Kelly and the team, this has changed dramatically, and I am a co-lead and my input is valued. This research is still ongoing. Carol and I were asked to help promote consumer involvement in research, and Carol appears in a video, and both Carol and myself appear in Yusuf's health brochure on this issue. Then I was selected to be part of a group known as Conviction. Over many months, with a lot of hard work and unbelievable commitment, we have developed a video, posters, and other material. And we now have a web page, not bad for a group that has been together for less than 12 months. Unfortunately, like many research projects, our current funding is finished, but we are hoping that additional funding can be found. There are still things we want to achieve. Who is Conviction? Conviction is a group of New South Wales health consumers that were brought together in late 2021 for a project funded by the New South Wales Government Office of Health and Medical Research. The aim of the project was to develop consumer co-designed resources to help increase awareness and participation in clinical trials in New South Wales. Membership of the group is diverse in health and cultural backgrounds, age, location across New South Wales, and in clinical trials experience. The team supporting Conviction include members of Sydney Health Partners, Health Consumer New South Wales, Northern New South Wales, LHD, and Accessor. My personal involvement is to do with neurology, and is for the Royal Melbourne Hospital and Melbourne University and Edith Cowan University in Western Australia, and with Sydney University Asthma and Macquarie University Mental Health in Aging, SEER and epilepsy forecasting. Some of it has been high tech and giving bloods, lots of it, and DNA. And if I have to do another cognitive testing evaluation, I will scream. The past year I had changed in emphasis, became very much involved in clinical research, both as a participant and as a community representative on a number of local and state bodies. My challenge is for next year to see more clinical trials on rare diseases and to make person-centered care become a reality. Will that be easy? No, but we need to make sure that patient-consumer is at the forefront of research, not just tick-the-box exercise. During this past year, I've been privileged to work alongside some truly committed and brilliant people, whether they be researchers with letters behind their names or community representatives who, like myself, bring the lived experience to further the significance of research in the medical field. I started as a newbie in this space, but it has for me been one of the most challenging but rewarding work I've ever done, paid or unpaid. If you're prepared to commit time and energy to being involved in clinical studies, you can achieve the great satisfaction of contributing to health research. In conclusion, I would say to anyone who wants to become involved in research, is give it a go. It is demanding and at times can be frustrating, but at times can be rewarding. And returning to my earlier comments on Rare Disease Day, and in particular stiff person syndrome, outcomes can only be improved by research. It is the only hope we have. Once again, thanks for inviting me to speak. I hope this day will progress the cause for more involvement in person-centred care and rare disease research, and for better patient outcomes.
And we need to be flexible when dealing with consumers as well. The next person I would like to introduce is Dr. Bernadette Brady. She'll be doing a session on the benefit of researchers in engaging with consumers. So she is a musculoskeletal and pain physiotherapist who holds a clinical specialty in South Western Sydney Local Health District. Thank you, Bernadette.
Thanks for having me here today. I'm just trying to bring up my slides. So just be 1 second. Okay. As Kate mentioned, I'm a clinical researcher, and my particular area of interest is working to improve pain outcomes for people who are from culturally and linguistically diverse backgrounds. Now, when I first started doing this sort of research, I was confronted with some obvious realities. The first being that I don't have a lived experience of chronic pain, and pain is such a subjective phenomenon. It's unique to an individual and influenced by lots of factors, including social and cultural context. And the second reality I was confronted with is I don't identify as belonging to a culturally and linguistically diverse community in any way. And so, having decided to pursue this area of research, it became pretty obvious pretty early on that to do this research effectively, we would need to partner and engage with consumers and communities. And so that's effectively what we did. We tried to broaden my unique healthcare provider perspective, so my perspective as a physio and what I thought I knew about pain. We tried to broaden our narrow research perspective, the previous research that had already been done to tell us about how to deliver pain management. And we complemented that with a consumer perspective. And in doing so, this helped us to form a more complete picture of the problem. And so I thought I would just start with that, which is for me certainly the most important benefit of doing research, engaging with consumers, has been it's helped us to understand the problem from a more holistic and person-oriented perspective, and allow solutions to be driven from this. And so I'm going to share a little bit about how we've gone about doing this, and how we've realised some tangible benefits from working in partnership with consumers. Now, before I go through some of the outputs, I first wanted to just reflect on, as a researcher, what are some of the challenges we encounter when we decide we want to do research, particularly involving culturally and linguistically diverse communities. And so some of the challenges that we can broadly categorise into either participant-related barriers, clinician or research barriers. And so participant-related barriers are, I want to engage someone who's from a CALD community, but I might face challenges of language. I might face challenges of misconceptions about research or cultural beliefs about what research actually is and what participation involves. And I might also face trust challenges, particularly if people have had perhaps not optimal experiences with the health system or with people in positions of power. There are clinician-related challenges to doing research that engages CALD communities. And in particular, for health research, our clinicians are often the gatekeepers of research participation, and they might hold bias in terms of who should participate or who would want to participate and how they communicate opportunities for participation to consumers. And lastly, there are research-related barriers. So research barriers encompass the cost of doing research, engaging diverse communities, the non-availability of translated materials, and the lack of culturally matched staff. Now, I'm not here to talk about a research perspective of challenges doing research with CALD communities, but I wanted to put this up to highlight that based on my experience, working with consumers can have a meaningful impact on each and every one of these domains and actually make the research process not only run smoother, but actually be more rewarding. And so I want to talk a little bit about how we realise this now. First of all, it didn't happen overnight, and it's been an evolving process. So when we first started this, there wasn't a clear guidance or framework about how do we effectively engage consumers in this particular area. So we started, first of all, by acknowledging that we didn't identify with the communities we were wanting to partner with. And so we had to build some relationships. And so if we think of the spectrum of consumer engagement research, we really started down at the sort of beginning levels, where we were really just about consulting communities and trying to build an understanding of their experience of pain or their experiences of their disease. And so to form these relationships and start to find a network of consumers who wanted to be engaged in this sort of research with us, we conducted a series of qualitative research projects. And so these different qualitative projects, which involved interviews and focus groups for key communities that we were interested in partnering with, gave us more of that knowledge, gave us more of that complete picture of the experience of pain. And so from this, we started to have community involvement in the research that we were doing. But we knew we could do better. We knew that it was one thing to just get stakeholder input, and it was another thing entirely to actually derive solutions and questions in partnership with communities. And so from there, we started to involve some key consumer representatives in the process of interpreting our information and deriving questions or solutions to how we could improve outcomes in pain for people from culturally diverse backgrounds. And so this next phase led us to pilot 2 different types of interventions that were very much based on some of the earlier findings from our qualitative research, but also from consultation and extended consultation with communities who gave us ideas about what sort of things we might try, what sort of things could improve the experience of pain management for people from diverse communities. So that's sort of taken us to the point where we've been able to engage communities in the development of questions, trying to form a more complete picture of pain. But still, we're at a point where the research process is still quite challenging, and we hadn't quite had the opportunity to have meaningful engagement in research-specific activities beyond understanding the disease and designing interventions. And so for this next phase, we again had some engaged consumer stakeholders who then formed part of a more formal advisory committee with us. And this advisory committee is really where we realised some of the most tangible benefits of working with consumers in research. When we go back to that earlier slide that I put up about some of those challenges engaging CALD communities in research, well, when we took these challenges to our advisory committee and got their input and their perspective and their lens on how we could overcome participation barriers, we came up with some novel solutions. So our consumers were the ones that helped us to design a series of videos and colloquially scripted that could help explain research participation in different languages that were reflecting the target communities we were interested in. And so doing that, we actually came up with a tangible solution to a challenge that allowed us to progress our research more smoothly. Regarding clinician-related barriers, again, our consumers, when we took it to our advisory group, they helped us to identify ways that we could have conversations with healthcare providers about why consumers might want to participate in research and how to introduce a particular research project to consumers if they were looking at providing them that initial information or the pathway to research participation. And lastly, if I look at research-related barriers, and these are often some of the costs and some of the challenges of translated materials. Well, when we worked in partnership with our consumers, we were able to get them involved in how the research was being conducted. And so some of our RAs attended some sessions with consumers who provided them first-hand experience, knowledge about how they would like to be consented or how they should approach consenting discussions in a way that was more sensitive to the target communities. They talked a little bit about how our processes were set up and how we could improve some of the ways we were trying to obtain outcome measures. And they provided meaningful input into the interview questions that we were aiming to ask, not only feedback on the questions we developed, but other things that would be important to know that might shape someone's outcome and help us to progress the questions further. We work a lot with cold communities, and so we had, again, consumers who were able to review materials we had already translated and give us meaningful feedback about whether that was phrased in a way that made sense and delivered the intended message. And they also helped us to select certain outcome measures. We would run it past our consumer advisory group and get their input on whether this is something that, as a consumer, would be either feasible or easy to complete, or contribute to an improved understanding of their pain experience. And lastly, from a research perspective, working in collaboration with consumers does open up actual grant opportunities. And so things like last year's MRFF consumer-led research is specifically targeting researchers who work effectively with consumers. And so we've taken this approach and tried to learn along the way about how we can realise the benefits of working with consumers. And we're now at a stage where we're really trying to formulate a shared vision and trying to work out not only how we can have consumers involved in the process, but how they can help us drive the process further and take on active roles to realise those benefits. And lastly, if everything I've said so far hasn't inspired you about the benefits of working with consumers, then it also attracts attention. So if you're more inspired by media and awards, then just think about how meaningful some of these outcomes are and how they can be picked up by both the public media, but also by New South Wales Health Awards, which holds categories that specifically aim to partner with communities and improve outcomes for communities. So thank you.
Thank you so much, Bernadette, for that lovely presentation. Again, just a reminder, if you have any questions, feel free to add them to the chat box or the Q&A section, and we will respond to them a little bit later. Now I'd like to introduce Carol Bleskens again and Ayano Kelly, who are going to present Partners in Crime, a case study of a consumer-led research project. Ayano Kelly is the Director of Medical Education and Senior Lecturer at UNSW, Medicine and Health, and Southwestern Sydney Clinical Campus. And Carol, who was previously introduced, is a Macarthur Community Representative Network member and also was the former chair of the District Southwestern Sydney Consumer and Research Committee. Welcome both.
Thank you, Kate. So before we start, we'd like to acknowledge and pay our respects to our Aboriginal and Torres Strait Islander peoples, the traditional custodians of the lands, the waterways and skies across Australia. We recognise and celebrate their unique cultural and spiritual relationships with country as we strive for equity and safety in healthcare. We pay our respects to Elders past and present for sharing and caring for the land on which we are able to work.
So following on from Bernie's talk, we are happy to share our project with a focus on the benefit of partnership between consumers and researchers. We feel that we are working on a near perfect crime. As with other criminals, we have schemed and used our collective strengths to work towards a common goal.
As a consumer research partner, I recognise that we have created something innovative and we are still in the place of learning. These learnings from one particular way of working in partnership, the positives and negatives of working this way, is what we will be sharing with you today.
So Carol, I've forgotten now how it all began.
As I remember it, we were in a video conference talking about potential big research ideas for a grant relating to people with musculoskeletal conditions, such as arthritis. We were a group of researchers, clinicians, consumers in the meeting, and as usual, as people were talking in the meeting, there are secret conversations happening in the private chats on the side.
I sent you a message. It said, I have an idea.
And then I said, uh-oh, what is it?
And I said, how about we do a consumer-led project?
Oh, that sounds interesting. Let's talk more about this. And then the scheming began. The idea was really new and exciting, and it felt like it was possible as there was a group of consumers already embedded in multiple research projects in the Musculoskeletal Clinical Academic Group. And this group was called the Musculoskeletal Consumer Community Council. And together we had many collective years of experience working in the consumer space.
I was excited to be working more with consumers. I already had such a positive experience working with various projects with consumers, and I thought it would be a great idea to support consumers to lead a project of their own. So after we chatted more about it, we both thought it's a great opportunity. We both have some experience in working in consumer research partnerships. What could possibly go wrong?
Exactly. So, starting with a small group of 3 in late 2021, there are now 37 people on the team. 18 are researchers, health professionals or students, and 19 are people who have lived experience of a musculoskeletal condition or community members, including 4 Aboriginal members and 4 from culturally and linguistically diverse communities. Meetings are held virtually to include all members, as we are from across Australia, New South Wales, Victoria and South Australia, and even internationally, Belgium and Denmark. The lived experience expertise includes some who've been involved on a national or international level as consumer research partners, as well as those wanting a new experience. The expertise of the researchers and academics includes those with established research and academic careers in university or research institutes, early and mid-career researchers, health professionals working in the health system, a rheumatology and general medicine advanced trainee, and medical students.
Our project we designed together is called Consumer PCC, which stands for Channeling Consumer Voices to Transform Person-Centred Care. Our goal, you can see there, is to deliver the kind of care people would like for themselves, their families and community by having consumer and community voices guiding all the work we do. The project we designed involves consumers and researchers co-reviewing existing quantitative and qualitative literature, then co-designing person-centred care pathways with people with lived experience from diverse geographic and cultural backgrounds. And then the final goal is to co-produce key recommendations for person-centred care, adapted for different contexts and populations, and supporting the implementation of these recommendations so people with musculoskeletal conditions can experience truly person-centred care.
There are a lot of projects out there for arthritis and other musculoskeletal conditions, but they don't always treat and include everyone equally, and they don't always listen to the voices of the people who live with their condition. We want to know how people experience their condition and find out what will work best for them to get the help they need for managing it. Over the past few years, there's been a shift in paradigm in the way consumers are involved in healthcare, with consumers being more assertive in negotiating the way their healthcare is delivered to them and their community. We want to add to this body of knowledge by listening to those consumer voices most marginalised by our health system, and do this in a co-create model with those who have experience of conditions such as arthritis. So, what is our model of partnership? The principles behind our model of partnership include building capacity of all study members, allowing consumer and community voices to guide recommendations, being truly responsive to the consumer community issues as they arrive from consultations, and finally, ensuring that our processes and outcomes are applicable to diverse contexts and people.
There's some examples of specific actions in relation to these principles. For our qualitative systematic review, we had summer scholarships, we upskilled senior medical students as well as new researchers. For our quantitative systematic review, we had consumer scholarships, including one consumer without prior experience in conducting research to undertake a second review process with weekly research mentoring and support. We've also ensured remuneration of consumers on research groups for all arms of the project. We've also had training workshops, 5 to date. One was on systematic review search strategies, another on Aboriginal research training, experience-based co-design with cultural and linguistically diverse communities, qualitative research training, and REDCap database training. And all of that training was open to all of our team members to develop their skills in a particular area and to make sure everyone was adequately onboarded to their individual projects. Right from the beginning, we had consumer and community voices guiding our work. Initially, we discussed a few ideas for the research project at first, and our consumers expressed how there were many gaps in their individual healthcare experience. And that led to our overall topic of consumers leading the design of person-centred care health delivery. We then decided to focus on one rheumatic condition. We had one consumer present background information on rheumatoid arthritis, and then 2 other team members presenting on osteoarthritis, as well as back pain. And that was based on their areas of lived experience or expertise. But in the end, our consumer won the vote and we commenced work on our first 2 projects in rheumatoid arthritis. We've had many discussions together on methodology and what to focus on in our projects. We have consumers embedded more closely in each study, and one of the consumers, Lynn, has been powering through screening 3,000 plus articles for the systematic review and really enjoying the process. We had our preliminary findings presented at national and state rheumatology conferences, and one thing I found amazing was that they were shared by our consumer members in their extensive consumer networks. In terms of community engagement, late last year we held an information session about arthritis. Present were 102 Arabic-speaking Iraqi men. We are developing relationships and consulting leaders in a number of Aboriginal communities, including rural and metropolitan areas.
So let's look at what has worked well. In late 2022, a survey was sent to all team members to gauge their experiences with the project to date and what would improve their engagement and move the work forward. There were 14 responses, 7 from consumer and community members and 7 from researchers and academics, which have been anonymised, and we want to share some of our findings with you here today. The project direction and philosophy, such as the commitment to engage with consumers and the community, was valued by members of the group. Having consumers co-lead and be the majority on the study team, as well as all team members being passionate about person-centred care, is really integral to our partnership. So one quote, "I have appreciated the truly consumer inclusive nature of the projects," and another, "being committed to engage with people in the community," which is really great. The second thing that's worked well was collaboration, which was really strongly appreciated. So quote, "Developing collaborative relationships with the team has been the best part. Members could choose their level of involvement, which enhanced the collaboration." So one member has said, quote, "No one is left out and each person can choose the level of understanding they wish to attain without being judged on their efforts. Most team members felt that the relationship they have formed was one of the best aspects of the project, including the variety of relationships." So, quote, "Meeting people with a breadth of experience and different perspectives," and, quote, "meeting new people and exploring different cultures." Feeling included and valued was also seen as a positive aspect, especially the consumer community members of the team. So one of them said, quote, "I know my opinions and insights are being valued." Another, quote, "My lived experience is valued." And the third, quote, "I all have a place at the table, no one is left out." The study team was experienced as being very respectful and supportive. So one member said, quote, "Everyone is showing respect for each other and no one has been invited as tokenistic or virtue signalling." So the last point in terms of what has worked well is the supportive environment. So the supportive environment on a personal level and for growth and learning was a positive for many team members. Having a mentor and the willingness of academics and researchers in the team to explain research made team members feel comfortable with what they are doing. And, quote, "No one is made to feel stupid or unwanted." Another one said, quote, "I'm completely new to the whole process of research and all the researchers have spent time ensuring I am comfortable with the screening tool and the researcher will continue to be my mentor through this whole process." The meeting format was identified as positive in this partnership. Our larger team meets virtually on a monthly basis and we meet on different days each month to fit in with people's other commitments. And this was pleasing to many, as with the recording of the meetings with the link being made available to all team members. The structured meeting format was seen as a positive and regular meetings with the consumers involved and other project teams outside the monthly meetings was seen as beneficial. So one of the researchers said, quote, "The recording of the meetings have made it more accessible when the dates conflict with clinic or other commitments." With some team members from Victoria and South Australia, the online format allows for greater involvement. Quote, "If the meetings were in person in my home city, I would have some chance of getting there, but I am limited by my pain and mobility issues."
However, in the course of trying to pull off our perfect crime, there has, of course, been roadblocks and unexpected hurdles. They're being collaborative rather than directive. Because the nature of this project and the model of partnership, we've always strived to listen to all opinions and be responsive, particularly to the consumer and community voices on our team. However, this does come at the cost of charging forward with the research. From the point of view of some of the consumers, they actually said things are slow at times, perhaps a little too much consensus effort. We're also really proud of the fact that more than half of the gang are consumer and community members, and that they represent a real diversity of lived experiences. However, with those numbers, some of the consumers have been looking for more opportunities to contribute to specific projects. Finally, there's a lot of enthusiasm for the project, and we have an ambitious, bigger vision we want to achieve. However, funding and the capacity of team members has been a challenge. The three of us who manage the project, myself as the research co-lead, Carol as the consumer co-lead, and our wonderful research coordinator, Danny, funded by the Musculoskeletal Clinical Academic Group, have been working at full capacity. The researchers on the team are engaged with projects in addition to their existing workloads, so the project is moving slower than we initially anticipated.
Yeah, so in conclusion, we're not here to say that we've pulled off the perfect crime. We know that we have a long way to go with our partnership with the research project. We're developing a process to apply to different situations, and we hope that others will learn from our experiences. We feel that it's good to be ambitious, to be true to the consumer voice, and to include diversity in these voices. By continuing to listen to a range of consumer voices and evaluating how we are doing things, we believe we can see many benefits.
And at the same time, we appreciate that our goal is to be collaborative, to offer opportunities, as well as answer to our enthusiasm and greater vision for the project. However, we also need to keep progressing forward and be realistic about what pieces of the crime we can pull off. Eventually, all our smaller criminal activities will lead to our major heights.
Yeah, and as with most criminals, our research syndicate, we want a reward. By listening to people, we will find out how they experience their arthritis and related conditions, what is important to them, and how they would like their care improved. And that is person-centred care. And we'd like to thank all the PCC team members and our supporters and funders, and we're happy to take comments or questions.
Yeah, thank you, Carol and Iano. If I just ask that you stay nearby in case there's any questions that might be directed to you guys. So now I'll take the opportunity to open up the Q&A session. And so we have Iano, Carol, and Shana in the room. So one of the questions was to the researcher who asked the question regarding accessing consumer for research purposes. Chat with the consumer participation manager across the district or Kate Jesus, who will direct you to us. Yeah. There's another comment there that's directing Bernadette to some other research that might assist. So thank you for that. Oh, Bernadette, would you like to provide a response if you're still online?
Yep. So no, just thank you for that particular research. I think, there's definitely a need for more research and more information to be out there about how to effectively partner with communities and consumers. So thanks.
Yeah, any other questions? If you had your time again, is there anything you would change in how you develop the team and work together? Yeah, you go now.
Thanks, Janelle, for your question. I was expecting that you might ask something. I think what we would probably do is not bring so many people on board so early, and perhaps work a little bit more slowly and spend a bit more time being clear about our vision early on, and making sure that we were able to just take a small piece of the crime rather than try and solve the whole thing all at once.
Yeah, and I think from my point of view, just realising that we all have capacity, so including our wonderful research co-leads, consumer co-leads, all of the people that are in the team, that, we can get really excited about what we want to do. And I think that's the beautiful thing about working with consumers. They're really passionate about what they've experienced and improving that experience, and we should support that vision as well. But that, we don't want to burn people out, and we want to make sure that we all look after each other in this research process. And so keeping within capacity, I think was one big thing for me.
So the next question we have is, where might health researchers start when setting up co-design or co-produce research projects? And are there any resources that you can recommend?
I think there's a lot of resources out there, and hopefully we can share that with the team. So there's
Yes, there's a lot of resources, both through Monash, who are doing a lot of work in this space, and also through Western Australia. And if you're in New South Wales, Health Consumers New South Wales have got a person who is specifically looking at health and medical research and involving consumers in research. But there are a lot of there's a lot of resources available, and we'd be happy to share those with you.
I think a lot of webinars and a lot of training that you can be involved in. And I think Carol's probably attended every single one of them as well.
Getting quite a few bits now. So the RA research is one of the best projects I've been involved with. And I'm really enjoying my time. I love the presentation to be shown nationally. We've got some great considerations there.
Thanks, Lynn. Lynn is won our consumer scholarship and is having to be involved in the research.
Yeah, and I think, Len, you really energized the project, and everyone, all the researchers that have worked with you just have had such a great time. And going through 3,000 plus articles is amazing, and you made that process so much more fun, I think, for people who would normally just slug through it and not really enjoy it. You made it really enjoyable and also very relevant, having your voice to what is person-centered care when they're screening articles. Thank you, Liam.
So our next question is from Janelle. If there are consumers listening interested in contributing to research, who should they contact? That's a great question.
Okay, so if you're in Southwest Sydney, I would suggest contacting Kate Jesus, who's the Consumer Community Participation Manager for the district. If you're in New South Wales, I would suggest contacting Health Consumers New South Wales, or Access CR, which is a social philanthropy group that Janelle in fact runs, looking at consumers in research. If you're in other states, I think every other state has a similar project to Health Consumers New South Wales, a similar organisation which you can join, and they are able to network you through your state.
Thank you. Okay. So thank you everyone for posting some of the questions. I think it was a really great opportunity to kind of unpick a little bit more and provide more detail as to how we can engage with consumers in research. So where to from here? Our South Western Sydney consumers are so valuable. Their passion, their interest and commitment to supporting and leading change in South Western Sydney is so inspirational. And I want to say thank you to everyone who's attended today, but also to our researchers and consumers for showcasing their work. In South Western Sydney, the Consumer Research Committee will continue to lead innovation and improvements to our healthcare services. The committee is leading a district scoping study to support researchers' engagement with consumers in all levels of research. And this groundwork for improvement of resources in South Western Sydney will ensure cohesion with consumers and researchers in future co-design. I look forward to working with this passionate group and everyone else and supporting the implementation of findings to empower our South Western Sydney community and hopefully even broader. I would now like to invite Professor Josephine Chow, Deputy Director of Research in South Western Sydney, to give the closing address and close our session for today. Welcome, Josephine.
Thanks, Kate. Right, so sadly, we're going to our final online session for the Beyond Health, Beyond Research and Innovation Showcase. Now, however, keep listen to me at the end. I'll give you some good stuff to take home as well. But I think to start with particular thank you for the speaker. All right, I know Eileen's not here with us today, but we wish her well. And she has spent many hours into contributing into preparing it, because I remember what she's talking about end of last year and so on. And of course, we got Carol, we have Karine, and we have David, and then we got our passionate clinicians, Bernadette and Ayano here, and all these other speakers, well, that I'm sure is behind the scene. We can't do this without our staff, right? So the research director, Anna Marie, Rachel, Morel, and Tiga. I'm looking at Tiga. Tiga, how long you be away for? The rest of the year. Oh, rest of the year. So she come back to the next series of the online workshop. Not too sure. Yeah, but that's the talking about partnership and collaboration. I still remember the first webinar, and now into the final webinar is like they can close the eye and do it perfectly well. All right, so again, this is really a series of work, and then I can actually keep an eye on the online tracking in, very consistent with the attendance online, and then it's actually pretty good, well received as well. The question, the comment are very positive and very well encouraging. So watch the space. In particularly is a lot of preparation already end of last year and of course this year to prepare for a virtual, no more virtual. It's in person research and Health Beyond research and innovation showcase in person early September. So it's not we're talking about in the past 2 days. No more. It's actually a whole week. So it's a lot of preparation around with the speakers, with the sessions. So we want to bring it across to the LHD, and then we go together in the same space on the Friday to celebrate all together. So keep an eye on those correspondents, either from the chief exec or from Yingyang or from the research directorate, and the program looking great at the moment. So take care. I will see you around. And once again, thank you for the speaker. And thank you for Kay to facilitate and chair the sessions. And of course, Eileen, we love you as usual. All right, get well. Talk soon. Bye-bye.